Ladies and gentlemen, a warm welcome also on my behalf. Dear speakers and guests from France, Spain, Germany, of course, and anywhere else. China. Today we have an interesting program that we had to change due to the fact that our prize winner of the Maria Buchinger Foundation Prize 2019, Mark Mattson, will give his presentation via Skype. And that led to a change in the agenda. If you have a look at the 𝗏𝗏𝗏 app, if you've downloaded it, you can see the change in agenda. This morning, after our presentation, we are going to have the presentation by 𝗏𝗏𝗏𝗏𝗏. He's going to talk about a high-tech way of monitoring or observing nature. He is our penguin specialist. He is also a specialist for many other animals, but penguins are just the crown of his career. He invented little robots that make it possible to observe the animals without putting them under unnecessary stress. Then we have Jean-Jacques Trochon, who is a pilot doctor, who himself, just like Otto Buchinger or 𝗏𝗏𝗏𝗏𝗏 or any other, have healed themselves and passed this on to other people. I'd like to introduce myself. I'm Françoise Wilhelmi de Toledo, and we both work in the Buchinger Wilhelmi Clinic in Überlingen and Marbella. I'm the head of the scientific department that we founded 5 years ago together with Franziska Grundler. Franziska Grundler is the program manager, scientific program manager of the Maria Buchinger Clinic in Überlingen and Marbella. In 2014, she received her Master of Science in Nutritional Medicine, and since then she's been responsible for performing clinical studies. What we are going to present to you today is the first major publication on periodic fasting, according to our method that we have here in the Buchinger Wilhelmi clinics. And the title of our presentation is Safety, Health Improvement and Wellbeing During a 4 to 21 day Fasting Period in a Large Cohort. English is the scientific language. So if you want to deal with science, you just have to learn English. But nevertheless, we are going to give our presentation in German, and our interpreters will give you the English version. We're going to start with a symbolic illustration, an example that our founder, Otto Buchinger, and the 4 generations of doctors and family members who've further developed this method. That is the image of the caterpillar and the butterfly. In the mid-20th century, the Dr. Otto Buchinger managed to heal himself and brought this method to life. And he made immediate parallels between fasting in animals and human fasting. Today, it's the opposite. All the scientific results come from the animal worlds, animal experiments, and then they are transferred to human beings. And it's of course easier to find animals for testing than human beings. He observed a caterpillar eating for weeks until it turned into a pupa. It triggered the metabolic switch from eating to fasting. And this led to a huge cell plasticity. That is the capability of cells to change, to transfer. And after some months, a butterfly emerged. From the beginning, Otto Buchinger had integrated the spiritual dimension of fasting, and he compared the butterfly with the human soul and the enlargement of consciousness that fasting can bring, and usually does bring. Otto Buchinger himself was a medical officer in the Marine, and in 1917 he contracted a streptococcal infection that evolved in rheumatic fever. 19 days of water-only fasting cured him completely, without relapses. And at the same time, this changed him at the existential level. He put together the program of the Buchinger Heilfasten, which today, developed by 4 generations of physicians and family members, is still practiced in the 3 clinics. Nature developed fasting and the capability of surviving when there is no food on Earth. Nature has developed many seasonal survival strategies, and the fuel switch, the switch from glucose to fat and ketone, this is something we call the switch, and this switch leads to exceptional therapeutical effects. For example, a metabolic reset, acceleration of autophagy, mood enhancement, modulation of inflammation, stem cell activation, and cellular regeneration. All this is developed during this Congress. The switch back from fat and ketone body usage to glucose processing induces cell regeneration. This metabolic switch will be the topic of Mark Mattson's presentation, also by J. Mitchell. And they have analyzed in detail what happens. Here you can see the switch in one direction, glucose to ketone, and then the other direction. That is the title of our 18th International Congress, so that people understand fasting is not eating, but instead fasting is a switch from one fuel to another, from external fuel to internal fuel. This title comes from several publications by Mark Mattson. The last one was from 2018. That was called Flipping the Metabolic Switch, Understanding and Applying the Health Benefits of Fasting. He called the first switch the G to K switch. That means from glucose to fat and ketones. And the reverse switch, when you start eating again, that is the K to G switch. That is the switch from fat and ketone to glucose. And we thought that was a very nice way of briefly illustrating what fasting actually is. Already in the 60s, Cahill calculated the general fat reserves of a standard man. That was 1.75 meters tall, 75 kilograms weight. And he concluded that an average of 40 days of fasting is possible if you push the system to the limit. In massive obese individual cases, fasting of up to 372 days have been published. There is a special case of water fasting, that is the zero-calorie diet, that was introduced to counteract obesity, and this has led to the hyperprotein diets that will be addressed by Johannes Wechsler this afternoon. He is actually the pioneer of the development of this type of weight reduction method for massively obese people. Several religious traditions associate fasting with praying and solidarity to the community and other living beings. The program of our clinics always combines these three dimensions in a globalized, contemporary way. The medical, the communitarian, that is the community that is generated when people fast together, and the spiritual dimension that can have different dimensions itself. This will be developed by our Jesuit friend Nicolaus Brandtjen, as well as by Daniela Liebscher in Berlin, who studied the Baha'i community. Every species living on planet Earth has its own survival strategy for the periods where there is no external food. Humans mobilize fat reserves, birds migrate while fasting, hibernating and fasting and sleeping, as well as in the case of penguin fasting. They save energy through huddling. They save their own lives and warm each other, and that saves energy that they need for survival. Yvon Lemao, the great specialist, is going to go into more detail in his presentation. Considering today's landscape of nutritional strategies and fasting strategies, we can distinguish between the following. First of all, calorie restriction, where only 70% of the daily requirement is ingested, avoiding malnutrition. So that means you have to eat much less than you would need to keep up your normal weight. That is a strategy to live longer. Then, nutrient restriction. That is interesting when you look at it more closely. We'll have this long period of low fat. Then we had low carb. And then, a premiere, we're going to talk about low protein diets, and even low methionine diets. That is an amino acid, and Jay Mitchell is going to say something about this later. In the fasting world, authors distinguish intermittent fasting, lasting some hours up to 2 days. And periodic fasting, that has been defined by Walter Longo. We've taken this definition because we think it's good, from 2 days to 21 days or more. That is called periodic fasting. The Buchinger Wilhelmi fasting program specializes in periodic fasting repeated regularly. We have a multidisciplinary team that cares for more than 6,000 people per year in our centers in Überlingen and Marbella. There are only few human studies on periodic fasting in human beings, especially in people who are not obese but have normal weight or slight overweight. In the Buchinger Wilhelmi clinics, we favor the periodic fasting, as well as real eating organic foods. And our aim is to improve eating behavior and use this as a starting point to improve lifestyle overall. So it's about experiencing yourself, what you can make with your own regeneration power and your own metabolism. Drugs and industrial diets that mimic some of the effects of fasting are considered by us as complementary in specific cases. I'd like to thank J. Mitchell for the idea of this slide. I hoped that he would look at it later, but he's taken it out of his presentation. But we have everything people can do with their own body and metabolism. And then we have a mimicking diet that has some of similar effects, but with Frank Madeo, we're going to hear a lot of detail on Sunday morning. Now we're going to talk about our publication from June 2019. No, January 2019. I'm a bit confused, sorry. January 2019. With the 6,000 people who come every year, 70% come and do periodic fasting, and 30% have a calorie-restricted diet with an individual nutrition plan. And with the reintroduction of food after fasting, this is something we really focus on. For 1 year, we documented the safety, the health improvement and the well-being of 1,422 subjects, and the results will be presented to you today.
I am pleased to be able to guide you through the results of the publication. In the prospective observational study, 1,422 patients took part who fasted between 4 and 21 days in the Buchinger Wilhelmi clinic in Überlingen. We divided this cohort into 4 groups of 5, 10, 15 and 20 days of fasting. All study participants received a comprehensive blood test before fasting and at the end of fasting. Clinical parameters such as weight and blood pressure were measured daily. In addition, patients were tested for the presence of ketone bodies in their urine. The well-being was documented by the participants in a diary. In addition, any side effects were continuously recorded. Let's start with the basic parameters. Our cohort was 55 years old on average. In the group with 5 days of fasting, we had the most participants, and with increasing fasting time, the groups became smaller. The proportion of women was about 60% and therefore greater than the number of men, with gender distribution being comparable in all groups. First, let's consider the weight loss in relation to the length of the fasting. As expected, a significant weight loss happens and is proportional to the fasting duration. Men, who are depicted as triangles here, lose significantly more weight than women. The same applies to the waist circumference. The waist circumference is reduced significantly in all groups, proportional to the fast duration and again stronger in men. Reducing excess abdominal fat is therapeutically useful as it releases inflammatory adipokines such as interleukin-6, tumor necrosis factor alpha, and resistin, promoting insulin resistance and diabetes. This reduction confirms our clinical observation that inflammatory processes improve during fasting. We were able to confirm this in another unpublished study. This table now shows the exact values for the weight loss of men and women after 5, 10, 15, and 20 days of fasting. Before fasting, the participants who fasted between 5 and 15 days had a BMI between 25 and 29.9. The group that fasted 20 days had higher values between 30 and 34.9. After 5 days of fasting, men can lose an average of 3.9 kilograms and women 2.7 kilograms. At 10 days of fasting, it is 5.5 kilograms on average for men and 3.5 kilograms for women. After 15 fasting days, there was a weight loss of 8.1 kilograms or 5.4 kilograms for women. After 20 days of fasting, men were able to lose 11.1 kilograms on average and women 7.3. For the waist circumference, the decrease varies between 5.2 centimeters in men and 4.1 centimeters in women after 5 days of fasting, up to 11.8 centimeters or 7.4 centimeters after 20 days of fasting. Fasting also has a significant effect on blood pressure. On the left side, we can see the reduction of the systolic blood pressure, and on the right, you can see the reduction of the diastolic blood pressure. In all groups, you can see that blood pressure levels stabilize at about 120 to 80. Thus, we have been able to document that blood pressure does not continue to drop, and accordingly, we did not observe any hypotensive crises. We could not see a difference between men and women. Other publications have investigated the molecular mechanisms that fasting has on the cardiovascular system. It has been found that the reduction of a sympathetic activity that accompanies the relaxation and stress reduction observed during fasting plays an important role. The levels of adrenaline and norepinephrine in the blood are lowered. In addition, increased sodium excretion and increased receptor sensitivity for the natriuretic peptide also contribute to the normalization of blood pressure through blood volume reduction. Blood sugar levels drop during fasting. Many other studies document the hormonal switch from insulin to glucagon and growth hormone. Our results show that blood glucose stabilizes in the lower normal range. There is no difference between the different fasting lengths that we observed. In addition, we observed that the HbA1c value was also lowered after only 5 days of fasting. Fasting thus has a positive effect on the glucose regulation. During fasting, the body breaks down endogenous fat reserves for energy. Triglycerides and total cholesterol levels decrease significantly in the blood. After fasting, the triglyceride levels in the different groups are at a similar level. This indicates a limit below which the triglycerides do not fall. Total cholesterol decreases similarly after 15 days of fasting. HDL and LDL decrease significantly, and it has been shown that a longer fasting duration leads to a greater reduction. The rate of LDL and HDL is not affected by fasting. In the Buchinger Wilhelmi clinics, fasting is supplemented by exercise, which positively influences lipid levels. This graph shows the rise of urinary ketone bodies with the onset of a fasting phase. After only 5 days of fasting, a plateau is reached, after which the ketone body concentration remains stable. In men, we have been able to observe slightly higher levels than in women. Our results have thus proven that the metabolic switch leading to ketosis has happened. Although we give daily fruit juice and honey, providing about 25 to 35 grams of carbohydrates during Buchinger fasting. Now, Next, we would like to take a look at the kidney function. As you probably know, fasting causes a significant increase in uric acid. We can see that this increase goes far beyond the norm ranges that are considered normal for people who eat normally. After 15 days of fasting, the maximum concentration seems to be reached, and it's not growing beyond that level. Despite this significant increase in uric acid, we have documented only one single gout attack in a patient, one out of the 1,422 subjects. He had previously suffered from gout and had been on a drug therapy before. The increase of uric acid at the beginning of fasting is partly caused by the breakdown of protein. However, more important is the renal elimination of uric acid. The renal elimination of uric acid and ketone bodies, that they compete for tubular excretion in the kidney. So the body chooses to keep uric acid and eliminate ketone bodies. This is called a competitive inhibition, which leads to the accumulation of uric acid in the blood. Let's take a positive look at this. Uric acid has a strong antioxidant capacity. It is the body with the highest antioxidant capacity in the body. A group around Mark Mattson has documented that in fasting mammals, both longevity and mood are enhanced, and that the brain is protected against ischemia by the high uric acid levels. So we have been able to show that this antioxidant capacity has improved, and uric acid plays a vital role. We did not observe any renal dysfunction in our cohort. Urea and creatinine stay within normal ranges. This was probably achieved by the fact that fasting persons are asked to drink a great volume of water. Now, let's take a look at liver enzymes, particularly gamma GT, GOT and GPT. When these values increase, then that's typical for liver diseases like hepatitis. People then feel extremely weak and ill for weeks, and those values skyrocket. In all fasting groups, we observed a very modest elevation of GOT and GPT, but within normal ranges. The gamma GT decreased, however, so it seems to be a very strange structure for a liver disease. And you're going to see more pictures later. A continuous enhancement of well-being scores didn't speak for a pathological situation. This modest increase is not clearly explained yet. If we go back in time, the time to the zero-calorie diet that brought many interesting insights for us, and we take a look at the pictures by Professor Wechsler in the 70s on zero-calorie diet, in 54 patients, he has been able to show that the GOP has increased, but after 3 weeks of a zero-calorie diet, they decreased again, and they were even below the starting point. So this shows that this increase is just something that passes away, and we don't see any clinical reasons to call it pathological, this increase, but we think that it is rather a sign of increased liver metabolism during fasting. In the blood count, we have been able to observe a significant reduction of leukocytes and platelets. But the normal range was never left. It was all within the normal range. In an unpublished study, we observed 3 months after fasting a return to the baseline. This was a study with 15 subjects that we carried out with the National Research Center in Strasbourg. We had 15 subjects, and 2 of those subjects are here today, so I'd like to welcome them very warmly. And those results correlate with the results of Mark Mattson and Walter Longo. In a very nice publication of 2018, they published that the number of all blood cell lines is reduced during fasting due to autophagy and regeneration of these cells from stem cells takes place a few weeks after fasting. This is the situation before fasting, and then some cells always regenerate from stem cells. When fasting is started, the cells are reduced due to the elimination of old or modified cells. Now the stem cells massively activate, but only weeks after fasting, the bone marrow has regenerated all the blood cells, and then you have the same number of blood cells, but the blood cells have been rejuvenated, as you may say. INR and PTT show a significant dilution of the blood. For people taking anticoagulants, this is of utmost importance as the dosage of the medication needs to be adjusted. The blood-thinning property of fasting could be used, for example, to protect against thrombosis, for example, on long flights. It could also play a role in surgical procedures. It's well known that during fasting, clinical symptoms of inflammatory diseases improve rapidly. This is especially evident in arthritis. In this study, we examined the erythrocyte sediment rate after 1 and after 2 hours. And that documents a decrease. There may be a correlation with the reduced fat circumference, which we already discussed before. In general, the values for sodium, potassium, calcium, and magnesium before and after fasting were all in the normal range. We observed a slight decrease in sodium. This can be attributed to the fact that more sodium is excreted at the beginning of fasting, because in the excretion of ketone bodies, an additional accompanying ion, the sodium is excreted. Once the kidney has got used to gluconeogenesis, the sodium is replaced by ammonium. Overall, we have been able to document 3 cases of low sodium in the cohort, all of which were normalized by adding salt. And they were only slightly underneath the norm with 127 to 131. And as I said, levels were normalized afterwards. One important aim of the study was to document the safety of the Buchinger Wilhelmi program. In our cohort, there were no life-threatening situations. Only 11 subjects reported serious side effects. These included cardiac arrhythmia, mild hyponatremia, mild hypoglycemia, 𝗡𝘂𝗁𝗔, gout attack, and vomiting. 2 patients had to stop fasting due to these side effects. The subjects also documented mild symptoms during fasting in their diary. symptoms which are usual in fasting. The most frequently reported mild symptoms were sleep changes in 15%, followed by fatigue, back pain, a feeling of hunger, and headache. Less than 3% showed sensitivity to cold, dizziness, blurred vision, restless legs, rash, and nausea. What was noticeable was that the symptoms occurred mainly in the first few days. In most cases, they disappeared on their own or were alleviated with natural remedies. The addition of honey and juice to Buchinger fasting may slow down the onset of ketosis, thereby facilitating a gentler transition to fasting metabolism, resulting in fewer symptoms. In addition, extensive care and medical care could contribute to the well-being of our patients. I would now like to continue talking about the well-being of our patients that has taken a special place in our study. The survey of participants has shown that both emotional and physical well-being were significantly improved in all groups at the end of fasting. This is an important factor for compliance. Looking at the daily course, you can see a continuous improvement. There are many reasons that can be cited for the increase in well-being. The weight loss itself triggers a positive feeling, particularly in overweight people. But also the metabolic switch itself seems to make a contribution, because studies about intermittent fasting have shown positive results. Fasting leads to the release of BDNF, which promotes the growth and survival of serotonin neurons. In addition, there is a release of endogenous opioids like beta-endorphin. Another contribution to improve the mood can be the decrease in inflammatory symptomatic, causing a diminishing in pain. In addition, the sense of self-empowerment that is obtained by successfully completing a period of intermittent fast can have a positive effect. Last but not least, 93% of the participants did not feel hungry, which was perceived by many as extremely pleasant and surprising, and is a very important factor in the feasibility of periodic fasting. Another proof of the effectiveness of periodic fasting is the alleviation of an already existing main health complaint. 85% of the 404 patients who reported having a major health complaint reported a significant improvement by fasting. When taking all study results into account, we come to the following conclusion. The Buchinger Wilhelmi periodic fasting program is a safe method. It increases both physical and emotional well-being. And it improves the state of health preventively and can also be used therapeutically. Now, we would like to come to our conclusion. This is our credo, what we believe in integrated medicine. Of course, there is natural approaches. I call it do the real thing. What we have in our metabolism, in our own genetic code. Such as, for example, go walk in a forest. And in particular situations only, mimic natural behavior and go to a gym. And before you use milk products for your baby, enjoy breastfeeding, at least the women among you. Thereby we focus on holistic fasting it's not just not eating. Of course, there is so many things that are going on that you experience with all your senses, just like when you walk in a forest. Nevertheless, there is people who can't go to a forest, and of course those people should be grateful for the devices and the help they get from the industry. When it comes to fasting, I think there's a similarity. Do the real thing. Just experience what you can do, what you can control, and that's fasting in all its dimensions. Or nutritional strategies like calorie restriction, time-restricted eating, intermittent fasting. And if that's not possible for you, or maybe if it's more useful as a complementary, then of course you could also use other products that may have one or mimic one or several effects of fasting. We would like to thank you very much for your attention.